everyone, and welcome to the second webinar in our two-part series on completing quality SOAR applications. Today we will be discussing medical records collection and organization and how this information can be also used to expedite the decision-making process at DDS. For this webinar sprang from a SOAR Voices blog posted this May. You'll know more about it from our presenters who each shared a role. My name is Pam Hine, Senior Project Associate with the SOAR Center, and I will be your moderator today. Before we begin, just a few housekeeping items to review. SAMHSA disclaimer. This training is supported by the Substance Abuse and Mental Health Services Administration and the U.S. Department of Health and Human Services. The contents of this presentation do not necessarily reflect the views or policies of SAMHSA or DHHS. The training should not be considered substitutes for individualized care and treatment. A few webinar instructions. As a reminder, your lines will be muted throughout the entire webinar. This webinar is being recorded and will be available for download on the SOAR website in about a week. You may now download the presentation slides by going to the top left of your screen. You click File, Save Document to download materials directly to your folder, or you can also go to the SOAR website now to download the materials. At soarworks.prainc.com, you scroll down to Webinar and click and find today's topic. At the conclusion of the webinar, you will immediately be connected to a brief evaluation, which we kindly ask you to complete. And finally, we will save all questions and comments until the end of the presentation, at which time we will review instructions for posing questions to panelists via the Q&A box. So just view today's agenda. Today you'll be hearing from Jennifer Ford, who was with the Division of Disability Termination Services in Washington, D.C. She is a Quality Assurance Reviewer, which is a new title for Jennifer. You'll then hear from Kate Bosch, who is the SOAR DC local lead and also Senior Clinical Case Manager with Miriam's Kitchen in Washington, D.C. And finally, Angela Ozarek, who's Senior Case Manager also with Miriam's Kitchen in Washington, D.C. We'll also have plenty of time for Q&A, which are facilitated by the SAMHSA SOAR team and our staff, too. So we're very fortunate today to have Bobby Grace, who is the SOAR Project Officer with the Homeless Programs Branch with the Center for Mental Health Services in Rockville, Maryland. Bobby?
Cam. As my name is Robert Grace, and I am the SAMHSA Project Officer for the SOAR Center. On behalf of the Substance Abuse and Mental Health Services Administration, SAMHSA, and the Homeless Programs Branch of the Center for Mental Health Services, to extend a warm welcome and all of you for us today during this SSDI Outreach Access and Recovery webinar called Complete Quality SOAR Applications in Medical Records and Things for Disability Decisions. SOAR states and communities increase access to Social Security disability benefits for eligible adults who are experiencing or at risk of homelessness and have a serious mental illness, medical impairment, and a co-occurring substance use disorder. Today's webinar will focus on strategies for implementing a few of the SOAR critical components, which are medical records, utilizing SSAs, services, and building relationships with DS. And I'd like to turn it over to Pam Hine, who will be moderating today's webinar. Pam?
Thank you so much, Bobby. Before we begin our presentations, I just wanted to remind folks who are joining us today what makes SOAR unique. And again, we know that having SOAR-trained caseworkers, they do much of the work. They're the ones who implement the SOAR critical components, especially if you look here at number 2, collecting and submitting medical records. We will be focusing today's webinar on the process of collecting records and how to submit them in an efficient way to Social Security. Also, we make sure that everyone today understands that first and foremost, we cannot do this work without the collaboration from the Social Security Administration and each state's DDS. Sometimes they're called other things like DDB, but essentially the state's disability determination services. These collaborations really help SOAR be successful, and it's where the SOAR case manager spends much of their time communicating with their DDS case adjudicator or analyst. So I just wanted to make sure that folks really understand that relationship, and this will be what our presenters will be really focusing on and sharing how they're able to, again, utilize these relationships and Social Security's online services to help make a quick decision. So I'm going to hand it over to Jennifer Ford with Washington, D.C. DDS, who will share a little bit about, again, their relationship with their local program, but also how to implement some of our critical components. Jennifer?
Hi. Good afternoon, everybody. My name is Jennifer Ford, and I'm a quality reviewer here in the District for Social Security. I'm just going to go over a big overall summary of how the disability process works and how it relates to SOAR cases. The thing that's very important for people to know is how we define disability, and it's important because we define disability different than vocational rehab or rehab services and different from the Veterans Administration. So, as the slide says, we define disability as a person who has a physical or mental impairment that prevents them from substantial gainful activity and that would last for a year or result in death. A simpler way to say it is a person is disabled according to SSA if they have a physical or mental problem that prevents them from working at a certain pay level, and that's what SGA means. So, as an example, for 2018, SGA is $1,180. In 2011, SGA was $1,000. So somebody can be deemed disabled and work part-time, but they can't make past a certain amount of money, and their impairment has to last a year or result in death. For the listings are conditions where someone is automatically found disabled if the medical evidence proves it. A simple example of the condition that meets a listing is a person who's getting dialysis 3 days a week. That's a person that's found automatically disabled. Another impairment where someone is found automatically disabled, if the records prove it, is a person who's in a wheelchair or a person that has lost the functionality of two extremities, two upper or two lower. And the slide shows a link for what we call the Blue Book. The Blue Book is the listings book, and it shows all of the impairments from cardiac impairments to mental impairments to impairments. It shows all the impairments that if the medical evidence proves a person has this condition, that they are automatically found disabled. A very, very important part of the listings and any disability application that we get is that we get the allegations, but as the slide shows and it's underlined, a statement about the symptoms is not enough. That's the purpose of collecting medical records. As the next slide says, medical records are critical to the disability evaluation process. They actually take the most amount of time. When someone submits a disability application, the time that it takes is usually what people seem to be waiting for most often is their process of getting medical records. The medical records function to show if the claimant's allegations meet the SSA disability criteria and document the duration and severity of the allegations. Usually when an examiner has the case, in the office, they get the case, they request medical records, it goes to medical records departments, they process it. It can take, ideally it'd be great if we got records within a day or two, but that can take sometimes up to a month or two, depending on how slow things are, if they don't get the request that was sent, and that's why ERE is kind of nice. Another thing about the medical records is that it helps to document the duration and severity. For SSA purposes, duration ideally is 1 year. So if someone is alleging disability today, for example, let's say it's for depression, it's helpful if we have records documenting that 6 months to a year before, so we see the progression of treatment, if they're taking medication, if the medication's not working, if there are problems with daily activities, and that's what the medical records help to show. One of the easiest ways to get record of us is through ERE, which stands for Electronic Records Express. So when you register for that, when you send the records in, because most cases are now electronic, it will go up right in the claimant's case. So you don't have to wait for the medical records departments to receive a paper copy of a medical record request, process it, and mail it. If it's ERE, usually it automatically shows right away and you skip all that wait time. In most agencies, the person that handles it is the medical relations or professional relations officer who deals with all external customer service issues for the agency. Continuing about ERE, the benefits of ERE on slide 13 shows no snail mail. So like I said before, you're not waiting for records to show up by regular paper mail. And again, rapid receipt of medical records. You don't have to wait for the record to be associated with the claimant. It shows up right in the case, and the examiner can look at it electronically, make notes on the records, highlight it. It's just a much quicker process. The other slide speaks about case development tips. I've been in this agency for about 10 to 12 years, and I was in another one for 3. One thing that you learn about processing, because the fact that medical records are important, is there's certain things the claimant can do or the representative to help the claim along. For SOAR cases in particular, it helps if we have a 1696. We can't talk to you if you're not the claimant if we don't know that you are representing the claimant. It's a legal issue. So if we don't have that, we don't know the claimant has a SOAR rep, we can speak to you. The next thing that helps is timely and thorough completion of any form sent to the claimant. We usually will, by mail, send the forms to you, and we need those ADL forms back so we can compare how the claimant says they're doing to what the medical records say. What happens a lot sometimes is that the claimants move or the phone number changes, so it does help if we have accurate contact information and something changes, let us know immediately. If we can't find a claimant or we can't find an applicant for disability and we don't get the information from their end, not much we can do either. As case processing goes along, if you notice that or know that the claimant has any additional treatments or had a referral that they finally went to the appointment for, or they had an X-ray or an MRI or additional testing, it helps to let us know that. That will help us to get a complete medical record for the case, and it would also prevent us from having to seek information elsewhere. One of the things we do, we don't have enough medical records from claimants' treating sources, primary care physicians, is we'll order CE, or consultative examination, which is on that slide, and those are important. When we order those exams, that basically says we have to get the medical records, we can get them in, we need something to explain how the claimant is doing. So we'll schedule those. Please try to attend them. If you can't make them, let us know in advance. You can reschedule. But when we schedule those exams, it's because you haven't got records. In DC, when we get a case in DC, we have a kind of a SOAR unit in the office. The examiners that take those cases, we have a lower case pending, so we can respond a little faster to any inquiries. And if you have a case that you realize that's a SOAR case, the field office just sent it over, and you wanted to get to one of us, just contact me, and I can get that done. If the case comes to our office here and it's already sent to an examiner, I can at least give the information for who has the case and the supervisor, so they know that it's a SOAR case and it needs to be given special attention. And that's actually all I have.
Thanks so much, Jennifer. Really appreciate you starting off with, making sure folks understand Social Security's definition of disability as well as the listings. And you'll see how Kate and Angela use that information to develop their case that they're going to discuss more about. So now, again, I'm going to hand it over to Kate, who's going to begin talking about her process, her secret sauce for efficiently organizing and submitting medical records to DDS for a quick decision. Kate?
All right, thank you, Pam, and thanks, Jennifer, for talking about DDS and your perspective. And we're really grateful for our relationship with you. And I'm going to talk a little bit more about that in a second. But just want to point out on the left-hand side of the slide, kind of the outline for our SOAR successes. This is like I think a good overview of what our recipe is, if you will, and we definitely invite everyone to check out our blog if you haven't already. My colleague Angela was able to get a decision on a SOAR case from DDS, but in total it was 35 days from the time the application was submitted to our local branch office to the time the claimant was able to receive notice of what her decision was. But most importantly, and why we're here, is to talk about how Angela was able to organize the medical records and then talk with the DDS examiner to point her in the direction of the test she needed in order to meet the listing to demonstrate the medical evidence that Jennifer talked about that is necessary to determine disability. So, like I said, this outline is really important, but I also think that one of the real keys that we've had, that we found success with, is staying in contact with the examiner and communicating that we understand what they need, and we've really been able to develop that understanding through ongoing conversations and meetings, DDS, and really just deepening our own expertise and experience using the SOAR model. So it's definitely important to identify what most pertinent records are for the individual that you're working with. So with that said, just kind of knowing what the list is related to the condition that they're saying is the reason that they can't work, being familiar with what listing requires. So really digging into the Blue Book. Actually, it sounds kind of tedious, maybe overwhelming, but it's a really accessible tool. And Social Security has a lot of really tools and tips that you can use their website, and then you can also go over to the SOAR Works website and kind of put it together and understand how to use it. And I was really intimidated by using the Blue Book at first, but it really does break down what DDS needs, and it'll really help you communicate with the DDS examiner to let them know you have what they need. So in order to knowing the listing is first and foremost, and then being familiar with where the individual receives treatment and who their treatment doctor is. What we run into is that we have a lot of big hospitals around our city, and within those hospitals there can be a lot of specialists, and so sometimes the specialists have their own offices within the hospital, so just kind of knowing where to send your request information is really important, because you want to know not where the treatment happens, but who the doctor is. And you also want to know who the person is living with, so that you're collecting all the records, but you're really trying to drill down into what is most pertinent for the condition that is creating the biggest limitation for them. And I think we're really lucky that we do have a relationship that's established with our DDS office and our local branch offices with Social Security. And we get to collaborate a lot with them. Even though we don't always get to see them very often, we still are able to have a partnership. And I think one of the ways that we've been able to do that is to establish a structure of kind of knowing who's who with the branch offices and also at DDS. Social Security has a lot of shifting roles. Sometimes people that we work with on SOAR cases might be reassigned or put on a detail that is out of control. So even with roles that are shifting, there's always someone that we can contact because we've established that structure and kind of understanding the hierarchy of who's who within the system we're working in. When we were able to establish the structure of knowing who's who is just start knowing one person at the DDS office, and at the time that was a different than Jennifer, who was the medical liaison, and come to our SOAR meetings and help us understand how we could start tweak and really nuances to our communication with DDS and Social Security. And we're able to have regular meetings at DDS, and so at our SOAR providers meetings, which happened every other month. And then we got to know the supervisor at DDS, and then we were able to meet Jennifer around this time, I think, last year. And so since then, Jennifer has really been instrumental in helping us collect with DDS by establishing the SOAR unit. That was something we had been asking for a year or so prior, and I think Jennifer and the supervisor just really saw the value to that because it also helps the examiners make quicker decisions and also have a part who's also collecting records and who's staying in touch with them. So in the SOAR unit, as Jennifer said, there's examiners who are familiar with the SOAR process. They've been there, I think, a little bit longer, and they also know that they can contact us. So what we do is we submit to Social Security the non-medical evidence in DC, and once our SOAR liaison at the SSA office process the claim and verify the non-medical eligibility, they send the case over to DDS, and then they let us know that, and then that's our cue to get in touch with Jennifer and let her know it's a SOAR claim and that we've had medical evidence or we're in the process of collecting additional medical evidence. We just need to schedule a CE or try to get a take form. So then we work with her to get in touch with the examiner that the case is assigned to, and so she'll assign it to an examiner, typically who is very familiar with the SOAR process. And then from there, this collaboration really allows us to have streamlined contact and communication about the case, rather than previously, like when I really didn't know very much about SOAR, I would just submit a case and then wait for a letter to come through the mail, and just because it's a big process that could take 2 weeks to a month to get that letter, especially for people experiencing homelessness. They might not pick up their mail. Sometimes get hard because the mail being a C96, just because it is a big process. So being able to just mail Jennifer or call Jennifer and say, Social Security just told me that this case was assigned or sent over to DDS. Have you been able to assign? She can tell me, and who the exam is and how to get in touch with them. And usually what we do is that we will ask the examiner a day or so of knowing that it's been assigned and let them know, hey, this is a SOAR case. I'm 1696. Can you see the 1696 in the claimant's file? If not, can I send you another copy? And also just letting know what we've got in terms of medical evidence, what we're trying to get. If we're an MSR and working on get a doctor to sign on the MSR. Also letting them know that if we do a really clear connection to a listing, where it is, and that we'll be uploading the records and that we'll let them know where they can find it. So we also work with the examiner to really manage the records collections. A lot of, as I'm sure most people do, we have a lot of hospitals that have their own release forms, and so sometimes claims that we're working with might get treatment from a particular hospital that has their own release form. That no matter how many times the examiner sends an 827 record, the hospital is just not going to send it unless they have their own release form signed. And I think it's just a breakdown in like institute medical records understanding what the 827 is. So we have within our SOAR provider community kind of created a table of contents of all of the treatment sources that we're familiar with in the area, including like Department of Corrections and all the hospitals, all the community clinics that people go to, that we share that information, and then we also include the links to these forms of each medical provider's website, so we can know that if there's extra forms that need to be signed, we can be sending those off. So sometimes I'll talk to an examiner and waiting for records from a particular hospital, and I'll know that hospital has their own release form, so I'll say, well, I just sent all that as well, and I will bring that over to you, or I'll upload it through ERE. Our DDS office is only 2 blocks from where we work, so we can bring records over if we need to. But I let them know that I'm also working on that. We can definitely help DDS get records that they need. The thing that's really important to us about our collaboration with DDS is that examiners know that they can call us, reach out to them a lot. One of our SOAR specialists on our team tries to stay in contact with every examiner that she's working with on all of her cases at least once a week, just to get an update and also let them know where she's in terms of documenting the medical evidence if she has more to submit. And then examiners know that we understand what they need. So that's something we've tried to establish, is that that just a written statement is not going to be enough. We're going to try to get doctor sign off on MSRs as much as possible, but we know that there needs to be medical evidence. And we also work with these to, and if this case really does need a consultative exam, and if so, what kinds of consultative exams, and we try to go through those consultative exams with the claimant as well. So I think in the last year especially, I've been really excited about the development of our relationship with ES and with the local branches of SA. I look forward to on collaboration and continuing to identify ways that we can assist examiners, because we know they have a task, and we know that there's backlog at Social Security, and in any way that we can support their work, we're in this together. So I think to say right now about our secret sauce and our relationship and collaboration, and so now I'll pass it off to my colleague, Angela.
Thank you so much. So I'm just going to tab forward one slide here. Really, a disclaimer to everything I'm about to say is that I'm the one who has inherited this excellent relationship that SOAR Providers has with DDS. I cannot claim any credit for that. So I very much thank those who have come before me, as I have only really recently got into SOAR, and I had this first case that I'll be talking more about, the one that the blog was on, in February, actually at the exact same time I was going to the SOAR Leadership Conference. So I was quite stressed out about it, and I didn't really know what I was doing. So for anyone who's feeling that way, everything is possible for you too, especially if you have a great team. So I would first thank much to Kate especially, and to the TA Center, who just were so helpful. So, but what I actually do once I inherited all those great things, mostly what I'm going to talk about is part of collaborating with DDS is trying to do as much work before they get the records to make their reading of the records as easy as possible. So in this case that I'm going to talk about, it was quite straightforward, though I have used the same strategy with other cases since that have been more complex. So what I mean by saying that this case was quite straightforward is that the woman for whom I was as a 1696 representative and using the SOAR model, had COPD. She was diagnosed with COPD, and as Jennifer was saying, almost every medical condition under the sun has a very specific recipe against which it can be determined if that person's symptoms will meet the Blue Book listing. And I found the COPD, quote unquote recipe or its listing in the Blue Book. As I was meeting with this client, obviously, at least for me, I do general case management as well. I'm not just doing SOAR with her, so I'm observing how it is for her to walk around. I see her become short of breath when we try to go to appointments, and I just talk a lot with her about where she thinks she might have records, all this stuff, and in mind the entire time I have the COPD listing in my head, just thinking, in the SOAR community, some people say step 3 is key, meaning step 3 is the sequential evaluation that Social Security uses to determine if someone is disabled, meaning they have an impairment that meets the listing. I was just thinking, will have enough to meet the listing. So I requested all of her records, and every time they came, it's kind of like or something. Like, I definitely open the records right away, and I'm like, skip through it as fast as possible, seeing what goodies it could have. And the very first time I get the record, I have like those little flag Post-its in my hand, and when I have time to sit down with the record, and I'm like so excited that it's there, I flag things that I think will be useful the very first time I go to the record. Or I also have a draft in my emails where I might say, ABC Hospital, page 17, IQ test of such and such. That's something for a case I'm working on right now with someone who has had a low IQ and a traumatic brain injury since childhood, just getting things right as I go through his records. So when I was going through this woman's records for this COPD case, I started sorting the records as soon as I got them. So I just had one big folder for her, and I would have smaller tabs in the folder for AC Hospital, XYZ Clinic, all those things. But even within those, because this woman was raised in D.C., and pretty much every medical event in her life, on her birth, happened at the same hospital. So from one hospital, I got truly hundreds and hundreds and hundreds of pages of records. So what I did was I clipped them apart using Post-its and paper clips, just to say, okay, kind of general life records, that's one big pile. But then I was looking at the listing and seeing, okay, she either has to meet some very specific testing about her lung capacity and how much oxygen can be held and used in her lungs at any one time, or she has to have a certain amount of ER admits within the year of onset, each ER admit being at least 48 hours. So as I'm going through the records, I am clipping off sometimes sections of records that are only 3 or 4 pages long. It's a very straightforward, add it to the ER, March 2017, for shortness of breath. She was there for 9 days. All that stuff, I just clip that into all on its own, and I put a Post-it on the front. Ooh, I'm sorry, I'm getting emails, so my computer's clicking at the same time. Sorry if that's anyone. But I'm just clipping the records off one by one by one into relevant points, like the points of my argument that I think I'm going to make to meet this listing. I'm sectioning the records off piece by piece, and I do that the entire time I'm getting records until I've gotten all the records. And then in DC, the process we do, we submit to Social Security once we finish the online application. We send them paper copies as well, and they will do the non-medical review and then send it over to DDS. That was actually the longest part of my process. That took 3 to 4 weeks, and then once DDS had it, it took me a couple days just to get examiner, get the barcodes back. But then once I had the barcodes, I was able to upload all my scans into the ERE section by section, and I'm about to tab over to show an example of what that looks like. But I uploaded in truly these very small chunks, and each time you use your barcode, there's a 50 MB limit on the amount of files you can upload into one section of the ERE. But then just take your barcode and you create another upload. So I ended up having 3 total uploads, and I'm going to tab to the next slide to show you what those looked like. So right on your screen is currently a very small example of this redacted case, the first case I did. I'm going to tab over to what that looks, so everyone's screen is about to change for a second. This is my example submission through the ERE. So I got this barcode from the DDS. You get to see my horrible whiteout attempt of writing over my whiteout to blind this. But on this first page, this is just mailing instructions they'll give you where I've handwritten blinded barcode. There was a barcode. There was all the client's information. And if you're not familiar with ERE, when you open it up, you'll have fields. You'll say start new submission, and you'll have fields to which all of this information is needed. The RQID, the site ID, all those numbers on there go somewhere. And then you'll be kind of given a blank screen to upload things. And you can see here on this second page, I uploaded in my first section of the ERE, which once again, each section of the ERE, each time you use the barcode, you can attach up to 50 MB of information with that of the barcode. So in this first one, I set all of her tests at a hospital nearby to us, which I have blinded its name as ABC, and I have blinded her name as Jane Doe. But I label each record, ABC testing and ER visit from March 2017. The next record, ER visit January 2017, and I've put a little note to myself, SOB, shortness of breath. Next visit, November through December, hospital admission that was admitted through the ER. For BS, breathing difficulties. The next one, August 2012, aches and pains. The next one, same ER, trips in 2011 and 2007 for shortness of breath. And once again, this was a very straightforward case, but actually when I was doing most of the medical requesting, she had not yet had the pulmonary functioning tests that show that she met the lung capacity required of the COPD. So what I was trying to do was meet the other requirement of the listing, because it's an either-or listing, showing she had enough ER visits that were at least 48 hours each within the year of onset, which she did. And then, so this is my upload, kind of where it says uploaded files, file name. Those are all the ones I just read. And very similarly to how we emphasize utilizing the remarks section on your SSA 8000, your SSA 16, putting in there that you're the SOAR case manager, you have more information and a couple relevant details you want to include. For every submission within the ERE, those 50 MB chunks that you can use with each use of the barcode, you can also include remarks, and I sure included a heck of a lot of remarks. And basically, I just walked the examiner through each file that I had included. So Ms. Doe is currently experiencing homelessness. I just threw that basic sentence that we use in so many of our remarks sections. 16 on the 8000, I'm the SOAR case manager, I'm the 1696, I can help you with what you need. Then I just jump right into the above files detail Ms. Doe's trips to BCER over the past 10 years. They are sorted from most recent to oldest. So I let them know immediately what kind of stuff they're going to be looking at. Then in the following paragraphs, which I will not read to you, and if you're feeling like you're not going to have time to read it during this call, please don't worry. The TA Center, not that this is that exciting to read, but if you are interested in the ERE remarks that I used, you're welcome to see them. The TA Center will make them available after the call. You'll be sent this file, but truly just gave a couple sentence summary of each file. And once again, COPD is a very straightforward listing, so I was just saying file A shows that she was in the hospital for X amount of hours on this date, file B, file C. Later on, I do actually end up getting the records that show that she has the pulmonary functioning tests that in the listing, so I'm going to tab through here. Pages, once again, you'll get all this. So as I said, I made 3 different submissions to the ERE just because of the file size limit. So I send all this. Here's her XYZ clinic records, and in these records are pulmonary functioning tests that she needs. And in doing this upload, I say, you know, the same sentence, Ms. Doe is experiencing homelessness. I'm her 1696. The above are her records from XYZ Medical Associates. The first 3 records, files 1, 2, and 3, include results from pulmonary functioning tests completed in July 2017, include results that indicate such and such. So I do all this. and then I make one final upload. Is less exciting, but because it's not where I'm talking about meeting the listing, but I want to be sure that I submit all medical evidence that I have been given. I don't want to hoard any medical evidence from Social Security. I want to present them with everything I have, but this one, these are kind of other clinic records that are a little less interesting to why I think she's going to meet the listing, so I just say these files show visits she made, often with similar concerns. You can check them out. So that's kind of those 3 uploads I did to CRE. And again, some of these files, it seems like a lot are uploaded, but some of the files have maybe 5 pages in them or something. So it took a lot of work to sort, but then when the examiner is opening these files, I'm telling them, in the file, you're going to find 5 pages about this one ER trip. That's exactly what they find. So now I'm going to tab back over to our PowerPoint here. So how that works, I kind of tried to talk through it as best as I could. If you're unfamiliar with the ERE, someone from the TA Center, obviously, as well as Social Security, can help you get set up, understand that better. I don't have time right now to kind of show exactly how the uploading works other than my verbal description, but what is important is just that as I said, the medical evidence has to be there, and we were talking to Jennifer before in planning these calls. She just emphasized how lack of medical evidence or delays in receiving medical evidence can be the #1 reason that cases are either not approved or not approved in a timely manner. So I think it was truly my nervousness about this being my first case that I wanted to do such a diligent job and know that the client would meet the listing even before I submitted this. But now that I've moved on to more complex or where the listing is less obviously met initially, I have continued to use this strategy of truncating my records into very small sections. The moment I receive them, I'm looking for things that are going to be important, and then I put a sticky note on the front, I paperclip it into a small section, and I tell myself exactly why this is going to be useful, and I upload those records to the ERE first because I want them to be the first thing the examiner sees, and in my later submissions, I include things I think. Obviously, I want to include all the evidence, but might be less directly relevant to my claim or why I think they meet the listing. And then once done with all this in the ERE, it automatically is sucked into the computer. But because we try to be in good communication with our examiners, I just emailed the examiner and I said, hey, I've attached all my notes from the ERE. You'll see them in there. And I just include one sentence to point you in particular to this client's ER trips, each totaling over 48 hours within the year of onset, as well as her pulmonary functioning test results, which can be found in the second upload in the ERE in a file named blah, blah. And so I uploaded that on a Monday evening when I was actually flying out to the SOAR Leadership Conference, and then Tuesday morning at the SOAR Leadership Conference, I get an email saying a decision had been made. So once again, I was lucky that my first case was such a straightforward one, but this process of just records, sorting them chronologically, and truly providing a map for the DDS examiner to read them is something I would recommend, and it is made super possible by the interface of the ERE. It is basically like creating a bibliography of your case, and you're the one who gets to dictate how you're presenting the records to the examiner. You're not going to withhold any information, but you do get to kind of curate the records in an order and commentary using the ERE remarks function that will allow for a logical reading. So I'm so grateful that this exists, and it made my job so much easier. So that's, I think, all I have to say. So I'm going to pass it back to the host.
Angela. I can attest to Angela getting the allowance because she was at the Leadership Academy where I was attending also, and she was so excited. And I think that's when we got the idea too. You need to share how that was so helpful to your applicant getting a quicker decision. So thank you. And Angela is what we call a clinical columbo here at the SOAR TA Center, because again, it's that sleuthing and it's that putting together the pieces essentially of a puzzle to really solve it. And Angela can also share a little bit more about the time it takes to do it, but also, as you can see, time well spent up front, save time in the back end with DDS, in some cases being able to make a quicker decision. So again, thank you so much, Angela, and Kate, for sharing that your story with us through the blog, and also here on the webinar. We all appreciate that, and I know everyone is learning so much on, again, how to utilize the listings, organize medical records, get them to DDS using electronic records. And again, thank you so much. And we do have plenty of time for Q&A, so we want to make sure that you know how to ask questions. So you may pose your question out to the panelists by typing your question or comment into the Q&A panel, which is located underneath the participant tab. And again, if we're not able to get to your question, we'll distribute them to the appropriate panelists to answer afterwards with a follow-up response. And again, we're looking for questions that are not specifically related to an applicant. We're looking for maybe some more general types of questions. Again, for some of those questions, we need more details. But again, we want to make sure that you have an opportunity to ask a question, and we have some that have come in. We have a question, several questions are coming in about Electronic Records Express, ERE. Jennifer, you had mentioned that an individual can enroll or register for ERE by contacting their DDS medical relations officer, MRO, or professional relations officer, PRO. Is an individual able to also enroll online, enroll in ERE through SSA.gov, through doing it online? Can you share some information about alternative ways? And Jennifer, if we still have Jennifer on the phone.
Can you hear me?
Yes, I can. Thanks, Jen.
Okay. I want to say no because you need a sponsor. When preparing for the webinar, I checked with my IT person about ERE, and he said you need a sponsor, so you need someone who already knows who can get you access to the system. Okay. So you can't just do it without having contact with the DDS.
Okay, great. That's a great clarification, because we have another question that asks, how can we get a list of, how can we find out who our SOAR point of contact is at the DDS? And again, Jennifer, this is for you. Can an individual enroll in ERE by their local Social Security office point of contact, or is it at and through DDS?
It's usually going to be through DDS. Every state in the district has its own disability determination office. Sometimes it's under Department of Education, sometimes under Health and Human Services. It depends on the state. So if you need to find out where the DDS is in your state, you have to kind of figure out what agency it's under. We are a federally funded program, but we're run by the state government, if that makes any sense. So every state's a little different. So you still have to go through the DDS, and you need to find the person in your state, probably just know where the DDS is housed, if that's just the question.
Yes, Jennifer, thank you so much. Because it's a national webinar, and we have folks from just about every state on the call. I think the first step would be if you do not know already, to go to the SOAR website, click on your state, and find who your state lead is. And if you are in a state that doesn't currently have a listed state lead, you'll see the contact information for your SOAR TA Center liaison. Contact that individual. We will gladly help you find out who your DDS MRO or PRO is, and if not, assist you with establishing a contact person who can get you set up. So again, check the SOAR website for your state lead. If you know that information already, contact your state lead or even your local lead, who again can share that information with you. Here's another question about getting medical records to DDS. The question is again for Jennifer, and again I think that Kate and Angela, please feel free to weigh in. From DDS's perspective, is it easiest to get medical records through ERE, or if the records were physically taken to the SSA field office upon initial application? I often have medical records long before the claim gets to DDS. Jennifer, talk a little bit about that.
I would say it's better to send it through ERE. If you bring it to the Social Security field office, we work together, but oftentimes we're not in the same building. And if you have actual paper, they'd have to send it by courier or attach it to the case. And as most cases are electronic, if they don't scan it in or something happens to that paper, and your originals have them anymore. So the safer way is to hold that information when they get assigned and you have an examiner, send it electronically. That way you have your originals. If it doesn't go through somehow by ERE, you still have something to reference.
Okay.
This is Kate. Oh, sorry.
No.
I that through our leadership meetings with our local branch office, we were told by Social Security they actually don't want any of our medical records just because they are so backlogged, and they're really only looking at non-medical eligibility. So they instructed us to hold our medical records until the claims got to DS. So we're still collecting medical records, developing the case. But we always give all of our medical evidence directly to DDS because Social Security has told us they just can't handle the volume.
And it sounds like this will be utilizing, ERE was very helpful for Angela to get medical records that may not have been available at the time the SOAR application was submitted. Angela, for other cases, you find ERE useful to get, rather than faxing medical records with the barcode, utilizing ERE, through your scanner to get them directly into the applicant's electronic folder. Have you used this in other cases where records came in maybe after the claim was submitted?
So I am kind of a nervous Nancy sometimes, and I can sit my cases until I feel like I have, and obviously I can't do this all the time, but sometimes I feel like, there's a golden nugget of information out there, and I want to wait till I find it. So often I'll try to, within the 60 days set after you file and the protective filing date, within those 60 days, kind of to me, day 1 and day 60 are the same. So I will say one of my main strategies is I set a local request as soon as possible, and then I really allow myself to not feel stressed during those 60 days. Like that time is in my favor to collect as many records as possible. But then, yes, if you do receive records later, the only difference in my strategy, because this first case, I did all the records in time that I was able to make one upload in one evening, but that's one of those things where I would have just emailed the DS examiner, because once again, we're so lucky to have a SOAR unit that I was introduced by Jennifer. So the field office, Social Security, sent they know non-medical eligibility was met. Your case is now in the hands of DDS. So I email DDS and I email Jen specifically, and I say, hey, I was just let known by the field office that a case is in your hands. You ensure that it's pulled into your unit and let me know when a DDS examiner is assigned. Jen responds and says, yes, your examiner is going to be Ms. So-and-so. And then she copied on this email. And once again, that's why my very first sentence was, I am lucky to have inherited so much, because this relationship was built for a long time. But Jen is just super on it and has seeded the person who I need to contact with. So I just reply and say, or I think she responded before I did, the examiner, and said, hi, what's your fax number? I've already put the barcode in the mail, but I can send it to you via fax as well. And I said, fax would be great. Send me the barcode. And so we emailed back and forth, and I said, I'll upload the records. Do you see them? Here are my notes from ERE. But if my records hadn't been in ERE at that time, I would say, I would do the exact same thing I did, but in my email I would include please review the records included, paying special attention to, point 1, 2, and 3. Also, please know that I anticipate records with meaningful information come from such and such a hospital that I will submit in a later upload to the ERE as soon as I have them. I'll check in again in X days or X amount, like next week, to let you know if I don't have them or I've submitted them to the ERE. Like, that's why the communication with the DDS examiner that Kate was talking about is so important, because the ERE is basically just a vessel for your records, and and if you have them all at once, that's great. But if you get them later, you would just let the DDS examiner know, saying, please review the records, and also know if you can hold the case pending one more upload. I hope to get them in 5 or 10 days or something like that, and then return to that provider and put pressure on them to say, I have a case in DDS's hands. Is there a way that this request can be expedited?
Great. Thank you for that. Again, you say that you inherited a great relationship, but it sounds like you have a big role in sustaining that great relationship through your ongoing communication and helping DDS, again, get records and quicker so that they can work on their decisions. So kudos to you for that. We have several questions that folks are still unsure if ERE is utilized in their states. At one time, they were told that it's not available in their state. Jennifer, do you know if ERE is available in all 50 states?
I want to say yes and be not sure. I think most states have it, but I don't want to be dishonest. Most are leaning toward electronic records processing, so it makes sense most states have it, but I don't want to say I believe so, but I don't want to confirm.
Great. Thanks for that, Jennifer. We'll be sure at the TA Center to send out some clarifying statements about ERE and make that available on SOAR website along with the PowerPoint slides today, and Angela's redacted ERE example will be there as well. Make sure we get that clarified to you as well, because again, we have a few questions about that from specific states. So again, we'll get some clarifying comments and that as well.
Speaking of the desk, I went to SSA.gov, and there's a whole page on ERE and how to use it and frequently asked questions.
Great.
So,
right. I will just also that on that page that Jennifer, you're referencing, there is a phone number for the ERE help desk, and they're super responsive. We call them often because we either need to change who our ERE login contact is, or we have some troubleshooting, and our experience has been that there's not a ton of wait time. They're really helpful. So I think even just calling the ERE help desk is a good start.
The website talks about the professional relations officer in each state. It gives you a phone number. Different states have different amounts of disability termination offices, so you'll see it based on the address. So like I'm looking at the Florida one, for example. Florida has Florida has 7 offices, so depending where the claimant is, you have to contact the right bureau or professional relations officer in the right area. But the website also links you to the professional relations officer in each state.
Great, so helpful, Jennifer. So ssa.gov/ERE. I get the information that Jennifer's talking about. And again, look for maybe an FAQ that comes from us, which will, again, make sure that you know whether you access it through ssa.gov website or through your SOAR state lead, your program. Because, again, many programs have established MROs and PROs already. So I think it would be great for you to first find out, if you have this established relationship already. Again, it's a great way to get to know them and also utilize the correct person as a resource that your state's using. So thanks for that. We did have a question that came up about troubleshooting technical issues with ERA. I tried to set up ERA, and the examiners told me they couldn't see anything. Who troubleshoots these tech issues, Jennifer. So it sounds like it is ssa.gov/ERE who can assist with those types of issues. Angela, it sounds like you've utilized through also their phone number too. Is that correct? Yeah, okay, Angela, you said you utilized a toll-free phone number too to troubleshoot some tech issues?
Tech issues, like with the ERE?
Yes.
I personally did not have any tech issues other than initially freaking out that there was a 50 MB limit before I realized you can infinitely use the barcode over and over again. So I personally didn't have any tech issues, but I know that others of us, because we all share the same ERE account at our workplace, and Kate could definitely have to communicate with ERE about like changing the password if it gets timed out, or where our emails are going to through the ERE and things like that. So yes, they are responsive, but I have luckily been not the one to have to do that work.
That was the Kate who had said we've used the help desk for ERE phone number, which we find helpful, and that phone number is available on the website that Jennifer referenced.
For that tag team answer. Appreciate it. Here's a question that we have that just came in. If you have records for multiple facilities, and this could be for Angela, if you have records for multiple facilities, would you still organize them as you described? So in other words, you might start with records from ABC Hospital and then a section from XYZ Hospital and then a section from EFG Hospital and so on and so on.
Yeah, so you can see when you'll get my example that I have multiple different providers in there. And I think the beauty of the ERE, though the examiner sees everything, once again, you're never to withhold any medical records information. You have to send everything that you've requested in relation to the case. But you kind of are in the driver's seat in terms of determining what order would it be most powerful for these records to be considered. And thus, I think it is almost kind of like writing a history class or something, like you're just making an argument. And so if you feel the brunt of your argument or the thing you want to lead with, like for that COPD case, is hospital admits, because that's what I knew about first and what I had the most records on, that's what I started with. And then I went into a different provider, which was XYZ Clinic, which had the PFTs that showed she had the right lung capacity. And then in my third upload, I went to the other providers, which didn't really have any strong points about my argument other than to say, you know, she's been presenting with similar symptoms at other related facilities for the past, 20 years. But I don't have that much to say about these records. So I think the beauty of the ERE is that, as opposed to, sometimes our clients have so many records that if we brought them in person, we'd probably, I remember someone shared this story at the Leadership Academy I was at, that they actually brought a duffel bag of records to the office. As opposed to doing that, you get to do a little more curation about what order you think makes most sense. So I would say the order totally depends on what makes sense for how are the things being described in the records relevant, showing that this client meets or approximates the listing for one or more conditions. And that is a question that I think changes client to client. So chronology might be most effective for someone who you're trying to say had childhood onset. Be more effective, like for my client who her COPD onset later in life. I just want to start. I don't need to say she's had this condition forever, because longevity isn't an issue. I just need to say she's had this condition with the symptoms that meet the listing, and so those are the records I started with. But what you want to start with, I think, depends on what argument you're to make, and not argument like you need to persuade anyone, but just like how can you show that the listing is met. I would start with what strongly meets the listing, whether it's from one provider or many providers.
Thank you, Angela. We did have a couple questions on, is it more helpful to send records in chronologically or by the strength of the record according to the listings? And you said that really depends on the particular case, it sounds like.
You would say so. Like, yeah, once again, the ERE is fabulous because, you decide what goes first, and not that the examiner won't read it all, but you just, what your thoughts about the case are when you're building the argument in your own head, trying to get the client to meet the listing. That's step 3, a Social Security listing. You get to present your thoughts in whatever order you'd like, because of the remarks section in the ERE. You can say, I uploaded these records because I want you to see such and such. So yeah, I would say the order is dependent on the case and what you conceive of the argument about the case in your mind. Just replicate that into the ERE. I included these ones because of this point, these ones because of this point.
Okay. And Angela, just to continue, a couple of questions on time management. So what was the time outlay for going through the records in that manner, and how did you roll that into your schedule? Did you do it in between other appointments and tasks, or did you take a big chunk of time to do it all? So can you talk a little bit about that?
So I took a little bit of time every time the records would come in. Once again, it very much feels like a present. If you do Social Security cases and you get your records back, it's like a holiday and you get your presents in the mail. So I would try to open the records and see what they were, but not paw through them unless I knew I had at least 10 or 15 minutes. So I did it in small chunks between other appointments, between other duties, just to do that initial, I didn't really highlight the records because I didn't want to write on them, but flagging of the records, oh, this page has something I want, let me flag it so I can come back later. And then I did probably take 3 hours at the end of the case when I was ready to submit everything to the ERE, which mostly was me figuring out how to scan things so that they would fit under the file size limit. But I did at the end lay out all the records I was going to scan them in with a Post-it on the front of what I wanted to call the record. That way when I opened my email, and how many file uploads I had in there, 3 sections with probably 5 uploads each. I opened my email and I had 15 scans. I knew, okay, scan number 1 is such and such file. Let me save it to my computer and name it. Scan 2 is such and such a file. So I would say it was from the moment I knew I was going to do Social Security with this client, spending 10 to 15 minutes doing a very basic skim. Sometimes that's way too much because you get back measly records from some providers where we get hundreds of pages from others, but spending 10 to 15 minutes at most when the record came in and I first was looking at it, and just using flagged Post-its to mark what I wanted to be able to point to when writing my MSR or my remarks. And then at the end, I did probably take 2 hours, but that's because this woman had probably 3 pages of records all told, so it doesn't always take that long. And in other cases, I've gotten better at it, and it goes much faster as I've become familiar with what I'm looking for. But just learning how to scan these in the appropriate size chunks, how do I then save the files with the appropriate names, But I would honestly say that was the majority of the work I did for the case, was just reading records, organizing them in the right order, ending them in the order I wanted, and then writing those remarks in the ERE. That was the majority of the case, really.
Okay. Thank you, Angela. Great tips. We are getting a lot of questions about your method for organizing medical records. And again, just remind folks that Angela's, redacted medical summary that she sent through ERE is available for you by clicking on the File button on the top left of your screen, but also going to the SOAR website under Webinars and finding this webinar. You can click on the PowerPoint and also that sample ERE as well. So a question for two, it has to do with the barcode. Somebody asked, how do you get a barcode, and do you need a barcode to send in records through ERE? Can you talk a little bit about the barcode? This is still online. Okay, Jennifer. So it may be that she having some issues with the phone or probably muted. Just star 6 to unmute if you are muted. Okay. So again, we have questions about finding out, again, who your local lead is. And I would suggest going to the SOAR website and clicking on your state. And if you, don't see a state lead listed or local leads listed, you will have the contact information for your SOAR TA Center liaison, who can certainly assist you, again, with understanding more about how your DDS works and helping you establish a program as well. Again, a question for Angela in terms of, you mentioned that it took 35 days to submit the application. Can you talk a little bit about how much of that time was spent on interviewing the applicant?
Yeah, sure, and I think that case is unique in that regard. So this one, I feel very lucky that not that I don't love SOAR, but not all of my job, and I get to do other things with clients, and I think they have a mutually beneficial relationship. So I spent a lot of time with the client, but I think not that much time, maybe like an hour or two, and this was a client who was able to present and verbalize their thoughts in a coherent, appropriate manner. I just finished a case with someone else who didn't have that ability, and thus we had to spend a lot more time together. But formally interviewing the client, not that much time, maybe an hour or two at most, but even that seems long. And again, this is a client, though, like he had previously been trying to work within the past 5 years or so, and so in her old email, we found a resume that I was able to get a lot of the work history from, and also in my remarks, I always include this client is experiencing homelessness and doesn't have a lot of access to verifying documents. Thus, all the details in this application have been presented to the best of our knowledge for accuracy, but maybe slightly incorrect. And it did turn out she didn't pay into the Social Security system all the years she thought she did. Social Security will figure all that out. So I probably only interviewed her for maybe an hour or so, and more used our time together when we were accomplishing other tasks. I know that the SOAR online course definitely recommends that you want to be trauma-informed, you want to create special space to hold some of the more traumatic events that clients may be sharing with you as they relate to MSR. So definitely down and I made space for that. But other than those specific questions that I wanted to cover and ensure we did in privacy in an office, we mostly just chatted as we, went doctor, as we did other things. The other client who I just did his case, he has a traumatic brain injury as well as a mood disorder, and the traumatic brain injury highly affects his memory. So really, I have not formally interviewed him at all, 0%, because his ability to answer a yes-no question or tell you what he ate for breakfast is pretty non-existent. And so instead, I was able to find out enough from him to log into his Facebook and at least to talk to his mom and call her and get the information. I really had to be creative. He didn't know where he went to high school, so but he thought he grew up in Gaithersburg, Maryland. So what we did was honestly, I brought up Google Maps satellite version of Gaithersburg, Maryland, and kind of zoomed around it until he found something that looked familiar, and I said, could you walk me to your high school from here? So we did that. I find I do very little formal interviewing and more just, depending on the client's level of functioning, try to spend time with them accomplishing tasks, and some of that obviously is asking the questions you have to know for the application, like where were you born, stuff like that. If the client isn't able to be a good primary source for themselves or they're a poor historian, like this client with a TBI, I try to get creative. For him, in requesting the records, I do not a lot of interviewing because he's not able to talk about it very well at all, so I just rely on the records, and then I spend time with him, and spending time with him let me know, we tried to take this client to the doctor, might accidentally offend someone in the lobby by having no sense of personal space and touching their hair without asking. And that time we spend together still informs me that, like, oh, his ability to adapt or manage himself might not be that good, or to interact with others. So, yeah, I personally do very little formal interviewing as part of the process. So we're to give it an hour's amount, like maybe 1 or 2 hours, but mostly because I don't just do SOAR, so I don't just meet clients in the office. When I do a SOAR case with clients, I just try to do at least 1 or 2 field trips with them, and we kind of chat more casually as I see them kind of accomplishing the tasks of daily living when we're riding the bus or something like that. And I feel that more than anything gives me a good impression of how to describe them.
Another great tip, Angela, for everyone in terms of to interview or the time you're actually spending with the individual as they perform their everyday activities like riding a bus. And so that's a really wonderful tip for folks that do spend a lot of time with individuals. So to do, to think of things outside of the office setting. And kind of about the Blue Book for medical guidelines, how to access those. And again, you can Google SSA Blue Book listings. Make sure it's SSA's listings and not Blue Book for cars. We also had available on the SOAR website and the online course as well. But again, I know that Angela, it sounds like she uses the, SSA.gov, to Blue Book, but the electronic version, the website, right? And also a little bit about, Angela, when you get your listing, do you print that listing? How do you really evaluate that listing? What's your kind of procedure for that?
So the COPD case, very straightforward. I just referred to it almost mentally, like, oh, she's going to need a PFT, a pulmonary functioning test, and I'm going to need to show 3 hospital admits. But for the case I just did, I actually didn't. The entire time I did the case, and I still don't know because the case is pending its final submission to the field office and transfer to DDS. With that gentleman with the TB, I have much less of a clear sense of which list he's going to meet. So rather, I'm kind of looking at those 4 areas of functioning, and I also do have printed multiple listings I think he could come close to, like schizophrenic-related disorders, mood disorders, as well as trauma-related disorders. And as when we go somewhere, because he is a font of information when he's not trying to be, because once again, he can't answer yes or no questions or provide personal historical information. So I'm just constantly, when we're together, I'm just constantly taking notes. And I do have in his SOAR file things printed, and just a couple bullet points about how I think he meets different parts. But with him, he will likely meet based on psychiatric hospitalizations. But I didn't know that until we got the records, because he's not able to tell me that he's been hospitalized for psychiatric reasons. So I've kind of been touring between several listings and taking also of the functional information. So yeah, I use the Blue Book very religiously, but with some of the cases where the client's not able to provide or remember where they might have received treatment, it's a little more of a piecemeal process where you might be juggling a couple listings, but also trying to keep, like I actually do have the MSR template that you guys have on your website on the TA Center. There's like an example MSR template. It's not a sample MSR. It's just like how you organize it, and I just print that out and I take it with us sometimes when we go places, and as he rejects details, says things like, oh, yeah, I think I was dropped on my head as a baby, and then, he says some non sequitur because he's very hard to maintain. It's very hard for him to maintain focus. I just jot that down in the trauma section or in the family history section. And with him, just like the slowest MSR ever, but over spending time together over the past month or so, didn't really have as religious of a listing use. Print out some, but much more so was fill in the MSR template, like what functional information am I going to include as well, just from my observations. Sorry, that was a long answer, but basically, once again, it just depends on the case. And sometimes they'll meet a listing really quickly, and sometimes I'm just kind of taking notes over time about what evidence do I have that they could meet a listing. That adds up in the end.
Right. It's the clinical Columbo piece. You're trying to really make the best, possible case for the applicant. And again, remember, it sounds like Angela works with folks that have multiple impairments, both physical and mental health, and you're really trying to look at the listings to see, how close they may meet a listing, and just providing that information to DDS, again, so that they can make a decision. And using their language as well, it sounds like, Angela, by understanding, again, what testing is required, how many, hospitalizations are required, how often does a person have to experience a symptom. So, again, I think that's a really great, tool, the listings, of course, and also our MSR guide. As Angela said, she's learned about, her client. Again, she's not getting all this information at once. It's over the course of time. And when she spots something, she sees something that could be very relevant to DDS to know about, she'll put that in the appropriate section of the MSR user guide. So, again, thanks for giving a plug to our tools that, again, is available on the SOAR website. We're almost running out of time, but we did have some questions about how do I send in a blog to the TR Center. I'd like to do that. So Angela and Kate, both of you, can you talk about your experience, how it came about where you wrote a blog, where you saw that, okay, this situation with this applicant, by utilizing some of the critical components, by getting a quick decision, how you came to want to share that with the wider SOAR community. Can you talk a little bit about that experience? Because we'd love to see more people share stories like this where you may not see a connection to a critical component, but knowing that you're putting in a lot of this hard work, how important it is to share that with folks. So just in words, we'd love to hear about how this came about.
I can start, and then Angela, I think we had kind of parallel experiences, but we were both super excited about the outcome and just the quickness of this case in particular. And it actually, for me, came about because I input all of our drop-in center SOAR cases into OAT, the only one whose hands are in our OAT, just trying to have some quality. And so I just try to make sure every time I read case notes that someone has been approved for a application, and I track all the cases that we're doing in our drop-in center. And I had seen that Angela got an outcome, and I was inputting information into OAT. And then when she got back from the Leadership Academy, I was just super excited and congratulating her, and then realized that I actually had the dates wrong, and it was a lot faster than I had put into OAT. So I contacted OAT manager at the TA Center and needed help kind of adjusting some of the information to make sure the data quality was correct. And I was just super excited and telling them, what Ayla had done and how quickly we got the decision. And it's the fastest that we've ever gotten a decision for a case that wasn't a terminally ill case. So, and also Angela's first case, and she had also just gotten back from the Leadership Academy. I'm a big fan of Angela as a colleague, so I was just really excited to share that. And as the TA Center emphasizes, when you go to the Leadership Academy, you just want to hear our stories. So I tried to share different successes or things that we're run to, and true to the TA Center's word, our liaison and all the liaisons that we interface with are always really responsive and really full, and also really wanting to celebrate alongside us. So then the TA Center had reached out to us because the OAT administrator had shared a story with our liaison and also Kristen, the executive director, and so then Pam reached out to us to see if we wanted to do the webinar, and also, I'm not sure, I think maybe it was Pam, you reached out to us about writing a blog. And Angela, I think you were sharing the excitement, like live streaming as it was happening at the Leadership Academy. Is that right?
I don't even know if I know how to live stream anything, but I do think I emailed you about it.
No, I mean you were telling them, you're like, I did it, like it happened in 4 hours.
Yeah,
Right?
Yeah, it was infectious at Leadership Academy. I think everyone was inspired, and you know, again, we were probably at that point where we're asking folks to share your successes. You know, we want to hear about them, and if you're out there, you know, on this webinar and you have a story you want to share, please do. You can always email that to soar@prainc.com. You can, again, work in collaboration with your agency lead, with your local lead, to tag team the story. How long did it take for you to write it? Did you enjoy the process of writing the blog, Kate?
I think I'm kind of a slower, but it only took like an hour or so, and I fact-checked it with Angela because obviously I'd gotten the dates wrong in the first place. But, yeah, we just kind of sent that back and forth, and I think we got it back to you guys in about a day. So it's not that long. It's not an arduous process.
Great. Thanks. It's supposed to be fun. Blogs are supposed to be fun. Again, thank you both so much. We did lose Jennifer. So on behalf of the TA Center, I just want to thank Jennifer from DDS in Washington, D.C., and especially you, Kate and Angela, for, again, sharing your story, taking the time to share a story with the SOAR community in your blog, and also spending time on your webinar. We really do appreciate it. So again, we are out of time. Just thanks again to the presenters, and we had lots of questions, and I didn't get to all of them, but we will definitely pose them to the presenters. Some may be more appropriate for your liaison, or you know, maybe your state lead. So we'll make sure we reach out to you with an answer, so that we don't leave you hanging. And again, thanks so much. We really do appreciate it. And again, don't forget to do the evaluation, and have a great rest of your day. Thank you so much.
Thank you.